my name is Erin, and I'm going to demonstrate how to insert a void catheter. And before you go into the patient's room, you want to check the MAR and make sure that you have the right patient, see how long it has to be, the urinary catheter, which is usually about 14-16 French, assess why they're getting it, and see if they've ever had a catheter before, and check their allergies, because when you clean, you have to clean with beta iodine, and you have to make sure or see if they're allergic to that. Then I'm going to go into the patient's room, ask them 2 patient identifiers, which is their name and date of birth, check their armband, again ask their allergies to be sure they're sane, make sure like they don't have any allergies that they know of. Tell them, explain the procedure, provide privacy if we had a curtain, and first, make sure you do the 6 rights as well. I'm going to apply clean gloves because first we're going to clean the peri area. And when you do this, you want to stick down one of these pads, and then you just want to clean your peri area. And then after I do that, I probably want to change my gloves, and I'm going to open the pit, and you're going to put down more pads. And everything inside of this is sterile, so when you open it, you want to make sure you only touch the edges. And you want to make sure that you raise the bed to a nice working height so you're not hurting yourself. And you want to make sure the patient is comfortable. And you want to make sure with a woman that her knees are flexed and her hips are abducted, sorry. So we're touching the edges. You want to make sure that this side is down, which is like the glossy, sticky kind of side is down, and putting it underneath, not breaking your sterile field. And then for a male, there is only touching the edges. You want to make sure there's this kind of pad, and it would go around their penis, but we don't need to use it for a female. Okay, so then I would take out these gloves, and we're now going to do sterile gloves. And you're going to do your dominant hand first. Make sure you're not touching the outside, and they're cuffed, so make sure you're only touching the cuff. And you might not have it on perfect at first, but you can adjust. Right, and now that you're sterile, you cannot go below your hips. So you want to make sure that when you're putting stuff in the trash can that you drop it from above here. And if it doesn't make the trash can, you can go back and pick it up later. So I'm going to set everything up. And since we can't use beta iodine on the mannequin, we're going to use hydrogen peroxide instead. So you want to drench the cotton balls with hydrogen peroxide. Drop below, or above, sorry. Make sure you get everything set up, so I'm going to put this in the port. lubricant. You want to stick this in the lube. So now everything is set up. I'm going to clean, and I'm going to use this hand to open it and my tweezers. And first, you're going to do far, come out, near, sorry, this would be a little bit better in real life. And then the last cotton ball, you would do down the center, out. Then you'd probably throw these tweezers away. Okay. All right, tell your patient they're going to feel slight pressure. You're going to insert it about 2 to 3 inches until you see urine, and then once you see urine, do it about another inch. You're going to hold this, inflate your balloon, pull back, make sure it's in, and it is. And then you would take the bag and put it on the bed frame. And then you're going to attach this, giving a little bit of leeway on top of her leg if she's mobile and on the side of the leg if she's immobile. And then you would go document.
And what would you do for a male?
And for a male, cleaning him, you would take 3 cotton balls as well, but you would start around the intermediatus and then go out. And then when you insert it, you want to go all the way up to the bifurcation. And you would put it on top of his leg as well. And you would, when you're inserting it, you want to hold his penis at about a 90-degree angle erect.